Welcome back to our series on pathology. This is part 3 if you have been following us. And if you are new to this channel, kindly subscribe and please click on the bell so you'll be the first to receive anything that is being posted. These things, you don't have to miss them. Okay, so question 51. During the histological examination of the left atrial auricle biopsy material, a rheumatic granuloma was detected. It had developed from the fibrinoid necrosis focus surrounded by basophilic macrophages, lymphocytes, fibroblasts, and single plasmocytes. Name the possible type of inflammatory reaction of the immune basis. First of all, before I get into the answer, for the benefit of studying, let me give you some few diseases according to each type of hypersensitivity. So for type 1, usually it is anaphylaxis and allergic reaction. For type 2 or cytotoxicity, certain immune diseases like Graves' disease, myasthenia gravis, autoimmune hemolytic anemia, Goodpasture syndrome, and so on and so forth. For type 3, we have vasculitis, serum sickness, nephritis, extrinsic allergic reaction, alveolitis, and so on and so forth. For type 4, we have contact dermatitis, tuberculin text reaction or Mantoux reaction or Mantoux text, granulomatous inflammation, allograft rejection, graft versus host diseases, etc. So from the examples I've mentioned, what do you think? This is rheumatic granuloma. So rheumatic granuloma means what? Type 4. And type 4 is the same as delayed type hypersensitivity. All right. So question 52. A 4-year-old child had a Mantoux test. Mantoux, what type of hypersensitivity is it? Mantoux is always type 4. Go back to explanation before. Anyways, so in 60 hours, okay, the question is what type of hypersensitivity is it? So this is type 4. So 52, your answer should be delayed type hypersensitivity. So a C. 53. A puncture biopsy has shown a diffuse infiltration of stroma by lymphocyte, plasmocyte, lymphoblast, plasmoblast, and necrotic arthritis in transplanted what? Kidney. What pathologic process has developed in the transplant? Again, I've told you, this is allograft rejection. So what type of it is it? What type of hypersensitivity is it? Type 4, which is what? Immune rejection. So that's 53. So answer is D. 54. Autopsy of a 6-month-old baby who died of sepsis has shown the absence of thymus gland. Thymus gland responsible for, T lymphocyte and lymphocyte production. Spleen weight and size decrease. Microscopically, there was detected the absence of T-dependent follicle zones with red pulp exhaust, the absence of pericortical zone in lymph nodes, which were represented mostly by T lymphocyte. So these zones of the peripheral immune organs are developed normally. What pathologic process do the facts indicate? All right. Now, deficiency of T cells means DiGeorge syndrome. the George syndrome. Now, deficiency of B cells is Bruton's hypogammaglobulinemia. Hypogammaglobulinemia. So if it's B is T cells, that means we are talking about what? The George syndrome. The George syndrome. All right. So 55. An infantile child of 14 suddenly died after acute respiratory viral infection. Autopsy has shown drastic thymus enlargement, generalized hyperplasia of the lymph nodes, and hypoplasia of the ovaries. Diagnose the disease. Now, thymus hyperplasia, that's leading to the enlargement, means thymolymphatic state. Hence, our answer is what? Is A. So it means that this patient is in that state of thymus enlargement or thymico-lymphatic enlargement, whatever. All right. So 56. 56. Whoa. What did I do? Okay. So 56. A 5-year-old child died of acute destructive staphylococcal pneumonia. During the examination of the thymus, its mass decreased to 3. Histological examination showed the regress of the glans lobus, greatly decreased lymphocyte amount with stroma collapse, layers inversion, ganglionic enlargement of Hiss's capsules. What is the most possible diagnosis? Now, our answer here is actually accidental involution. Accidental involution. And this is why. Now, accidental thymus involution or transformation is the reduction in the size and the mass due to thymocyte migration to the peripheral immune organs and blood, as well as due to the partial decomposition and absorption by macrophages. And according to Ivanovskaya, that's a Ukrainian name actually. It's a method of classification. Accidental involution consists of 5 stages. It consists of 5 stages. But I cannot give you all these things because of time. So I will encourage you to go to the description box and download the book that you can find this thing in. It is in the description box. So please download it. So the answer is accidental involution because it best explains all these things that are actually what happening. All right. So 57. Yeah, 57. Autopsy of a 57-year-old man who had hypertensive disease and died of cardiac decompensation. Cardiac decompensation has shown an enlarged heart with dilated cavities. Microscopically, cardiomyocytes noticeably enlarged with fatty degeneration and hyperchromic barrel-shaped nuclei. What is the most possible pathological process? Now, due to the enlarged heart with dilated cavities, easy to diagnose hypertrophy. So that means we are either it is eccentric or concentric. Because of enlargement is hypertrophy. This one is not denoting anything concerning hypertrophy. So by elimination, we have eliminated this and we are left with just 2. Just 2. All right. So now according to the stage of adaptation, 2 types of myocardial hypertrophy have been described. 2 types have been described. One is a concentric. Concentric. Now, concentric is where the masculine nature or the musculature is clearly enlarged, but the chambers of the heart are not dilated or they are not enlarged. Whereas eccentric, both the myocardium or the muscular nature of the heart and the chambers are both enlarged. Both of them are enlarged. So, from the question, we have, of course, enlarged heart with dilated what? Cavities. This is definitely eccentric hypertrophy. So your answer here is B. Please, if I'm moving too fast, just rewind, play it again. That was a video. All right. 58. A 40-year-old man with stenosis cancer of esophagus, that's without metastasis, has the atrophy of skeletal muscles and subcutaneous fatty tissue. The skin is of sallow brown color. Epidermis is thin and the heart is diminished. The myocardium and the liver are of brown color. Diagnose the disease. Don't forget there's no cancer here because it's been cleared. It's been cleared here without metastasis. In cancer, there's always, most of the time, metastasis. All right. Now, atrophy simply means reduced number and size of cells, tissues, or organs. It can be general or local. Now, the general type of atrophy is due to stenosis of the esophagus. In this question, it is due to what? Stenosis of the esophagus, hence inadequate food intake. And when there's an inadequate food intake, it means what? Alimentary. So your answer here should be what? Alimentary. All right. So the answer is E. However, for the benefit of studies again, Addison's disease is simply a disorder due to insufficient production of hormones by adrenal gland. Myasthenia gravis is a chronic autoimmune neuromuscular disease that causes weakness in the skeletal muscles. And brown atrophy is simply an atrophic tissue with yellowish brown color, usually seen in heart and the liver. All right. So your answer is definitely E. So 59. A patient who had gastric carcinoma died of cancerous cachexia. Autopsy has shown characteristic changes in the heart. How can we call such heart? Come on. What did I say about brown atrophy? Yellowish brown color seen in what? Heart and liver. So your answer is what? Brown atrophic. So your answer is C. C. A teenager who complains of muscular atrophy and negative volume of the shank after a long-term regenerative process of the femur fracture without nerve damage. How can we term such atrophy? Now, this is a type of local atrophy called dysfunctional atrophy, which developed due to reduction of the function of the organ. So, it has lost its functional ability. Therefore, our answer is D, dysfunctional. 61. A histological examination of an endometrium scrape of a 45-year-old woman who had a disordered ovarian menstrual cycle has shown an increased amount of endometrial glands. Some of them are corkscrew-like convoluted, the other cystic dilated. Diagnose the disease. Come on. You have seen glands increase, glands, and then you have what? Cystic. So, what could possibly be your answer? This is definitely what? Glandulocystic hyperplasia of endometrium. Don't forget, increased amount of endometrial gland is called what? Hyperplasia. And of course, cystic dilated means cystic. All right. 62. Sorry. A patient is a heavy smoker. In the bronchus biopsy material in the thickened mucous membrane, there was detected a chronic inflammation and transformation of simple ciliated epithelium into stratified pavement 1. What process? So movement from one state of a cell to another type is called, of course, metaplasia. So your answer is B. 63. A patient who has been smoking, another smoking again, had a cough. He complains of general weakness after he lost 12 kilograms in the course of last 2 months. After biopsy material, there is what? Squamous cell carcinoma was diagnosed. Squamous cell carcinoma. So what could be the reason? Of course, metaplasia. So your answer is C. C. Don't forget, in the respiratory tract, we have what type of epithelium? It's called pseudostratified columnar epithelium. And if it has changed to carcinoma, definitely we are talking about what? Metaplasia. So 64. A traumatic injury of the liver, its structure and functions renew completely. It renewed completely. That means there was regeneration completely. It got healed completely. So what is your answer? Of course, restitution. Restitution. A patient has a deep lacerated blunt edge wound covered with, some say pus, some say pus, whatever. Marginal parts are filled with succulent granulation tissue that does not rise. It doesn't rise above the wound level. Name the form of wound healing. All right. Now there's going to be some teaching over here. So the process of wound healing are 1. Healing by first intention, which is characterized by clean and uninfected wound, surgically incised without much loss of cells and tissues, with edges approximated by surgical sutures. That is for primary. We also have healing by second intention. This is characterized by an open large tissue defect, which is sometimes infected, loss of cells and tissues, and not approximated by surgical sutures. Now, a deep lacerated blunt edge wound covered with pus. Come on, what do you think? Is healing by what? Second intention, which is also called healing by secondary. Second, whatever. So it's the same thing. So it's E. So our answer here is E. 66. Tumors. Oh, this place. Try. Anyways, we have no option. A histological examination of a new growth has shown that parenchyma has been formed of integumentary epithelium with an increased amount of layers. Stroma together The stroma together with epithelial perforation forms papillae, term the form of atypism. Atypism means, abnormal cell growth. Atypism. All right, so let's do some learning over here. Now, neoplasm. Of course, this is definitely neoplasm or tumor. And a satisfactory definition of a tumor is the presence of mass or tissue mass formed as a result of abnormal, excessive, uncoordinated, autonomous, and purposeless proliferation of cells. Therefore, the form of atypism here is what? Tissue. I know it sounds confusional, but don't be confused. It's when the tissue is a mass of what? Tissue. A mass of tissue. So your answer is E. A gastroscopic examination of a patient has shown a pedunculated tumor 1.5 centimeters in diameter in the area of lesser curvature of the stomach. What kind of growth does the tumor have? All right, we have to learn this one because this is not new to us. All right, now depending on the degree of tumor differentiation, there are three types of growth. We have 1, expansive, apposition, and infiltration or infiltrative. All right, now under expansive, it grows from inside, moving away the surrounding tissue. Apposition is due to the transformation of normal cells to tumor cells, whilst infiltrating is a tumor that invade normal tissues and destroy them. They invade normal tissue and they destroy them. Now let's look at the exophytic. This is an expansive growth of tumor to the cavity of the organ. Now, endophytic. This is an infiltrating growth of tumor deep into the wall of the organ. Now, with our description over here, they said a penetrating tumor in the lesser curvature of the stomach. So that means we are talking about what? Exophytic. An expansive growth of a tumor to the cavity of the organ. Don't forget, expansive means what? A tissue which is growing away from the surrounding tissue. So this is definitely what? Exophytic. So your answer is D. 68. A microscopic examination of the biopsy material from the tumor in the right bronchus mucous membrane has shown the cell and tissue atypism, that is tumor. Appearance of some structures in the form of epithelial pales. Define the pathological process. Now your clue here is what? Epithelial pales. Now epithelial pales also means keratin pales or keratinized structures formed in regions where abnormal squamous cells form concentric layers. So, now, these cells are sometimes seen with squamous cell carcinoma. Hence, the pathologic process is called malignant tumor. So your answer is malignant tumor, C. 69. A histological examination of the biopsy material from the chronic non-healing portio vaginalis of a 47-year-old woman has shown the signs of cellular atypism. The basic membrane is without changes. Without changes is your clue. So diagnosis, this is what? Carcinoma in situ. So your answer is B. Don't forget there's no changes. 70. A new skin growth of solid consistency that look like a noodle with papilla surface. Your guy is what? Papilla surface. and reminded cauliflower was removed. Microscopically, the tumor consists of many papillae. My brother, don't waste your time. The answer is what? Papilloma. The answer is what? Papilloma. So, A. 71. During the histological examination of a stomach tumor, a great amount of signet ring cells. So your guy is what? Signet ring cells. This is profound for mucoid carcinoma. This guy is very, very profound, or is found mainly in what? Mucoid or colloid carcinoma. So, what type of cancer is it? What cancer is it? This is mucinous. Don't forget mucoid, mucinous. So the answer is D. 72. A 62-year-old man had a kidney removed. A microscopic examination has shown a tumor in the form of a node, approximately 8 centimeters in diameter. The tumor tissue is variegated with multiple hemorrhages and necrosis on the cut surface. Histologically, the tumor consists of light cells that form alveolar and papillar structures. The invasive growth of the tumor is moderate. Many cells have pathological mitosis and hyperchromic nuclei. Diagnose the tumor. This is simply cancer of the kidney. And cancer of the kidney is also called renal cell carcinoma. Finish. Answer is A. 73. A histological examination of a mammary gland has shown a tumor consisting of poorly differentiated atypical cells of epithelial genesis. They form trabecules separated from one another by connective tissue. The cells and the stromal correlation is approximately 1:1. Name the histological variant of the cancer. Of course, this is obviously a breast cancer of non-invasive type. That is what? A type of what? Carcinoma in situ. Carcinoma in situ. However, carcinoma in situ microscopically is divided into 4. We have the solid type, the comedo type, the papillary type, and we have the cribriform type. Again, I recommend you download this file in the description box for better understanding. So, of course, this is carcinoma in situ, and I've mentioned 4 types. What do you hear? Of course, solid carcinoma. So your answer is C. 74. A pathological examination of an endometrium strip of an elderly woman with metrorrhagia, that is a discoordinated menstruation, in menopause has shown an atypical epithelium with excrescence with the formation of epithelial pearls. Again, your guy, epithelial pearls. So what is it? This is squamous cell carcinoma of skin. Hornification is also, hornification means keratinization, don't forget. So this is what? D. 74 is D. All right. 75. A 55-year-old woman had uterine bleeding. Diagnostic dilatation and curettage of cervical mucous membrane were performed. Among blood elements, glandular elements different in form and size, formed of atypical cells with hyperchromic nuclei and numerous mitoses were detected. What can we think of? Of course, this is definitely talking about what? Cancer of the uterus. Cancer of the uterus. Cancer of the uterus. And this can be called adenocarcinoma. Adenocarcinoma. So your answer is A. 76. A bronchoscopy of a 62-year-old patient has shown a polypus mass nearly 1 centimeter in diameter in the initial part of the right lung proximal bronchus. A histological examination diagnosed a tumor built of small lymphocyte-like cells with hyperchromic nuclei. These cells grow in strata and tension bars. They grow in strata and tension bars. What is your possible variant of the tumor? Now, this description can be seen in oat cell carcinoma. Oat, the food oat. Oat cell carcinoma, also called undifferentiated small cell carcinoma, which is composed of uniform small cells, dense oval nuclei, which are organized into cords, aggregates, and ribbons around small vessels, forming pseudorosette. So, with this definition and description, our answer should be undifferentiated small cell carcinoma or oat cell carcinoma. So your clue here was what? The arrangement in strata and whatever. 77. Gradually, a patch with necrosis and ulcer in the middle has developed on the patient's skin of the face. A pathological examination of the biopsy material has shown an excrescence of atypical epithelial cells with numerous pathological mitosis. What is most probable answer? This is definitely skin cancer. Skin cancer. Atypism means cancer. Skin, of course, on the face. 78. In the mammary gland biopsy material, solid layers built of small epithelial cells with polypus nuclei and numerous pathological mitosis were detected. The quantity of stoma is minor, but with lymphocytic infiltration, diagnose the disease. All right. Now, one of the breast cancers with better prognosis is medullary carcinoma. Why? Because it has lymphoid infiltrate in the tumor stroma. So this is definitely what? C. Medullary carcinoma. Why? Because there is an infiltration of what? Lymphocyte in the stroma. All right, this is 79, and I will take a break. When we come back, we will continue. And please, if you've not subscribed, kindly do. And this video, I'm proud to say, is brought to you by Ken Andrew Educational Consult, where we help students get admission in Ukraine. All right, so please enjoy and have a wonderful day. Bye.